Hey guys, how are you? It's me, Dr. Kris, and I'm back. This is KION Pediatrics, and this time our tip we'll be talking about is 5 old wive tales in pediatrics. Okay? 5 old wive tales. In other words, myths, what you've commonly heard, maybe from grandma or great grandma, or maybe even grandpa, but are generally not true. Here's number 1. That fever is bad. Well, fever alone in itself is not harmful, right? And it's unlikely to cause a brain damage, or even your cases of febrile seizures are generally not that dangerous, because in itself, fever is not a disease, and I'm sure you know that. It's a symptom, and the body has its way of fighting diseases. One is by fever production, right? So generally, if it's a baby that's less than 3 months old and has a temperature of 100.4 or greater, then you should contact your pediatrician, right? If it's a baby between the ages of 3 months to 6 months old and the child has a temperature of about 101 Fahrenheit, then you should contact your pediatrician. And also, if it's a child that's greater than 6 months old with a temperature of 103, that's another time to contact your pediatrician. Now for older kids, here's my rule of thumb. Generally, if the child is acting right, playing or playful, eating well, not lying around lethargic or fatigued, and it's just generally his normal, usual self, then that may not be the time to contact your pediatrician, and it also may not be a time to treat it, right? That's number 1. Okay, remember that fever in itself is not only may not be the only sign of a serious infection. There could be others that is accompanying the fever. Here's another old wives' tale, number 2, that fever is good. Well, it's true that the body fights infections. One of the ways is by a production of a temperature. And so the truth of it is that not all fever needs to be treated. But like I said earlier, if the child is not acting right, or the child is lethargic, or the fever is really high, so we're talking 101 and higher, then that would be the time to contact a pediatrician and maybe also to treat it, right? Here's some of the things that you can do. You can alternate between acetaminophen and ibuprofen, right? But you want to make sure that the child is getting the right dose, and your doctor or your pediatrician will tell you the dose based on the child's weight. The correct time to alternate is like every 3 hours, because acetaminophen is every 4 and ibuprofen is every 6 hours, so the alternation between the two is every 3 hours. So like I said, remember, if it's generally low-grade fever and the child is acting right and is eating well, feeding well, not fatigued, not tired, you don't generally need to treat a low-grade fever. But here's also something that you also need to remember. If the fever is caused by an infection, the fact that you treated the fever with acetaminophen or ibuprofen does not make the infection go away faster or clear faster. You're just treating the fever, which is more for comfort of the child. Okay? Now, here's number 3 old wives' tale. That teething causes a high fever. And I know you've heard it. I know you've heard it several times. It may cause a low-grade fever, like 100.3, 100.4 perhaps. But a high fever, 101, 102, nah. My basic rule of thumb is that teething will not cause that. Also, teething doesn't cause diarrhea or vomiting or diaper rash. What teething generally causes is increased irritability and fussiness, and sometimes nighttime awakening, and maybe even some mild pain. But you know what you can do? Massage the gums around the teeth. That helps. A hard teething ring that the child can chew on, that also helps for comfort. Now, a teething gel or some acetaminophen or ibuprofen, it's not recommended generally to do that, but if it does help, then you can try it. A teething gel may work a little bit. Number 4, what was it? What's that famous one that I know everyone has heard? My child's runny nose is green and yellow. He definitely has a sinus infection. That is an old wives' tale. That's a myth. Here, one of the most common causes of that green, yellow, runny nose is a virus. And it doesn't always mean that the child has a sinus infection. Basically, a sinus infection is when the child has that greenish, yellow, runny nose, and it has occurred for more than 10 to 14 days. There may or may not be fever, and sometimes there may be head pain, frontal head pain, or headaches. But most of the sinuses that are caused, or the green runny nose that are caused by viruses, will not require antibiotics, because you know that antibiotics will not treat a virus. So that would be a waste. And not only that, you will just probably be helping your child develop resistance to that antibiotics. So the fact that it's green and it's runny, and you think it's a sinus infection and the child needs antibiotics, that's a myth, an old wives' tale.
I heard you guys talking. I've got one to add. Don't forget the myth that fever and milk don't go together. Some parents were taught to limit milk intake during a fever, which is actually not necessary. The ingestion of milk during a fever does not increase mucus production and thus does not induce vomiting. We encourage parents to continue the child's regular diet and focus specifically on increasing fluids to prevent dehydration.
Wow, that was a good one. Oh, by the way, that's Becca Ward, my APRN. She's great. You know, the famous word that parents use is clabber. You know, I checked dictionary. I'm not even sure that's a word. But what they're trying to say is increase milk production, mucus production, and making it thicker, hence harder to swallow and maybe even throwing up. So that was 5 old wife tales in pediatrics. I will come back again with maybe 5 more, but remember to check us out on our YouTube page, Instagram, and Facebook at KION Pediatrics, and also our website, which is KIONPeds.com. Until next time, this is Dr. Kris here at KION Pediatrics.